Welcome to Safe and Sound, sponsored by White Mountain Fire and Life Safety. Today on the show, we have Janelle Linn with Navajo County Child Fatality Review Team and Cecilia Fernandez with White Mountain Child Abuse Prevention Council. Welcome to the show, ladies.
Hi. Thank you.
Yeah.
Hi.
I'm very happy to have you to the show today. We're going to talk about some things today, though, that aren't very happy. So, Janelle, what do you do for the Child Fatality Review Team? What is that exactly?
So I'm the coordinator for the Navajo County Child Fatality Review Team. And what we do is every child who resides in Navajo County that dies under the age of 18, we review that death. A death review looks similar to this. We request records, medical records, law enforcement records, school records, behavioral health records, hospital records, EMS run records, things of that nature. We have a team that meets quarterly, and we sit down and we review all those records for the different children that have passed away. What we're looking for is, were there contributing factors that led to that death that could be prevented? And we then classify that death as preventable. We're unable to determine because we either weren't able to have enough information, or maybe the death is still under investigation, so we only had access to part of the records, so we're unable to determine, or no, it couldn't have been it could not have been prevented. It was caused from a medical cause or something that was unpreventable. For the deaths that are preventable, then we go out and try to develop a strategy in our community to keep similar deaths from occurring.
And then that's kind of where your planning, or your part
council.
comes in. The council
Yes.
comes in. Thank you. Thank you.
Yes. So the council has been here in the area for about 4 years or so. The purpose of the council is to create partnerships between community organizations and community members to discuss ways that we can educate or have activities, have information to families to help them in situations that can prevent child abuse. And so it's a long-term goal of outreach and education that we're looking to do, and it's starting with community organizations and kind of reaching out more towards that.
And one of the reasons that you guys are working together right now is that we've had an issue recently where some deaths could have been obviously could be prevented, and that's something that came to through Summit, and there was an emergency summons that kind of got together, and we talked about some kind of a spike or something.
So the team in our county consists of representatives from local hospitals, Indian Health Service, injury prevention groups, CASA, there's physicians on the team. So we try to, educators, law enforcement, we try to look at it from a broad perspective, so we have a variety of expertise at the table so that something isn't overlooked. And then we also kind of watch trends that are going on in the community. So were alerted by the member of our team who works in the ER at Summit that they had an influx recently of pediatric deaths, specifically in children, very young children under the age of 2. And since the fall of last year, there'd been a huge spike in either children being seen in their ER for injuries that were consistent with child abuse or neglect, and a large percentage of those ended up passing away. And so that trend, it was a real spike for our area, and we realized it's something that we really needed to look at and get on top of. So we decided to form a work group. And at the time, we were kind of unaware that Cecilia's group existed. So after we had a few meetings, we were made aware of the Child Abuse Prevention Council. And so since we've kind of blended that, and now since we look at deaths from all causes, she's more child abuse specific. This work group is actually going to be moving now under her organization, so that these are strategies that have a long-term effect and are not overlooked.
And what are some of the things that you'll be able to do regarding to try to combat this or prevent this, mitigate this?
Right. Well, one thing is just putting the word out there that the council is here right now with the work group that was started under your leadership. We were able to kind of make other organizations aware that we were here, and not that they weren't doing anything before. It's just under, different co-lead, different networking contacts and things like that. We were able to get a lot more information out. But moving forward, what we want to do is educate and outreach, especially on adverse childhood experiences, which is a study based on what happens in your childhood can be carried on later in your life and has outcomes, negative health outcomes. And so it is one of the public health crises that is out there now, because we're seeing people who have had multiple issues in their childhood, such as could be a parent who abused substances or seeing domestic violence in the home, things like that, that created that trauma for that child, and later in life they're seeing that they're having, cardiovascular issues or other health issues. So that's one part of training workshops that I'm trained to provide to the community. Another one is protective factors training. So this is more of that kind of prevention specific to parents to think about, what they can do to create social connections if they're moving here from out of state. How do they get the resources that they need? And training them on what typical child development looks like, because sometimes they may react to their child's behavior and think that it's something personal against them that the child is doing, but really it's a typical behavior for that child's age. So really kind of educating parents in how they approach parenting and discipline, and giving them those supports and tools to be able to calm themselves down when they're in a heated moment, and remove themselves from that situation. So that right now is our primary goal going forward, but we also have materials that we can hand out. April is Child Abuse Awareness Month, and so we're working on getting some of these trainings provided to different organizations in the area, as well as community-based training so that parents and caregivers can come as well. So there are a lot of things that we can do, but mostly right now it's really just about getting the word out and providing education.
Bringing in the awareness that we obviously do have a problem in our community specific to child abuse, and having you as a resource is phenomenal that connection was being able to make.
Right, at the time that it was made, absolutely.
Yeah, pretty quickly, which is exciting. So, so basically, we're kicking off to Child Abuse Awareness Month, because this is airing all of April,
Right.
And there's going to be some information going out into the movie theaters, video to bring awareness to people to see something, say something, right?
Yes,
Correct.
that's going to be our primary message. Is we're not at this point able to discuss numbers because there are investigations pending and things like that. But I'll tell you, this is a pretty significant spike, especially considering that the 2 years prior we had 0 deaths in children related to abuse or neglect. So we need to be aware there is a problem, and we can't be blind to it. And if you suspect something or you see something that's suspicious, don't be afraid to say something. And that's the main message we want to say, is see something or say something, because it's better to be safe than sorry. If an investigation's done and nothing is found, oh well, but what if something is found and you could have prevented that, and by not saying something, there's a tragic result.
And don't rely on somebody else.
Right.
That's the biggest thing. Oh, they'll take care of it. The more people who call on something too, you're a voice for that child. And the phone number is is 188 SOS Child.
Yes.
And when I remember when I first looked at that phone number, I was like, wait a minute, child, that's more than 4 letters, but it doesn't. The last letter drops off, so you don't even have to dial it. And we'll have billboards so people can see that. But once it calls, that sends them to DCS. And I remember talking to one of the guys at DCS, and he said the biggest issue is everything's, they don't tell anybody's name. They don't say who called in, but people get scared and think, oh my goodness, I'm not going to give them my name. I'm just going to tell them. So when they have follow-up questions, they don't have anywhere to go. And what that does is that's not allowing the follow through. You have to give your name, or if you really want to help that child, give your name. Nobody's going to know it's you, but so that they can call back and have that follow up.
Right. And it helps them verify that it's a credible report versus, you know, a malicious neighbor's angry at you or something type of a situation.
Which is frustrating that people take advantage of a system like that. I remember working for the fire department. We got a lot of calls sometimes where you go and they're like, yeah, their bags are packed and they're ready to go to the hospital. And we're like, we're not a taxi service. Yeah. You know, I'm not going to give you a $1,500 ride to, you know, the hospital, but I have access. It doesn't matter what you have. If you need a taxi, we'll help you out and we'll call you a taxi. But what it did is it took our agency and it took us away from focusing on other issues that were more emergencies. Right. And that's what something like that does. And that's just my personal opinion and from my background. But anyway, so the other thing is we want to try to encourage people to get help. You know, and you said you had some ways of telling people, you know, leave the kid, walk into the other room. What are some things that we can tell people right now, just in case? I mean, I have 3 kids, and I have a 3-year-old who's ornery as heck. I love her, and she's sweet, and I'm proud of her, but sometimes I'm just like, Alice, you have to go to your room. I can't handle you right now.
Right. And it's that recognition that you've reached a boiling point. You know, you have to have that kind of self-awareness to say, you know what, I feel like I'm going to blow up, and I don't know what that blow up's going to look like. So either removing you or the child from that situation. You know, if the child's safe in the living room watching TV or doing what they're doing, and you need to step outside just to take a breath of fresh air, that's fine. Or, you know, the other thing is you can call somebody, and that's where we talk about having those social supports and how that's important. So if your neighbor's there, you know, and just say, hey, you know what, I need to go for a drive for about 10, 15 minutes. Are you okay staying here with my child? So finding those ways to understand yourself, and when you're going to reach a boiling point, understanding those things that trigger you. You know, it may be something that the child's doing that really isn't necessarily a problem, but it's triggering something from your past or from your past experience, some type of trauma that you had before. And so, you know, understanding those things and really having an understanding of yourself is really important. So taking some time to talk with parents about, you know, kind of what gets you frazzled, what gets you frustrated. You know, if you come home after work and you've just had a really stressful day and now you have your children and your family to take care of, how do you manage that? What coping skills do you have? So a lot of that is just finding the tools that they already have, but just don't realize in the moment that they can use them.
You know, I'm fortunate to have my husband that I can bounce things back and forth. And there's been times where he's like, I just need a minute. I need to go to the room. I can't handle you people right now. Just leave me alone. And we trade off. And I've had days where I've come home like that on a bad day at work or whatever, and I've come through the door and I'm like, I can't do anything right now.
Right.
I'm done for the night. I'm going to sleep. And it's on you.
Right.
It's just like, okay. But there is parents that don't get that opportunity,
right.
And to be able to build that support structure and understand that your children are your number one, and you got to be able to have those people to lean on at those times. And there's nothing wrong with it.
No.
Nope.
You know, there's nothing wrong with getting angry. There's nothing wrong with having those feelings. It doesn't make you a bad person. You just have to recognize, like you said,
right, that you're human and that you have buttons that people push on purpose, some that they push on accident, and you really just have to figure out kind of, okay, what's that button that's going to push me over the edge? Yes. What's that button that is going to, you know, really kind of change the course and figure out ways to calm yourself down, remove yourself from that situation, or talk to somebody to, you know, really get you out of that mindset. Yeah. And
it's, I have a girlfriend that I'm a support system for, because this is her first baby, and we've talked about a couple things, and it was so funny because she didn't realize that other people have experienced what she experienced. People don't think that. She's like, are you kidding me? You had a difficult time breastfeeding. And I was like, yeah, I had toe curling pain. I wanted to pull my hair out. And she's like, what a relief. I'm not the only one. And knowing that you're not the only one and that people can get through it is really a huge step in understanding that, again, you're not the only one.
Right, exactly.
This is going to be okay. So through this this awareness campaign, it's going to go on for a while. We have to address this, because it's not stopping.
Right.
And we don't know what the causation of this is, but we do know it's an issue, and we have the tools to provide to the community.
So one of the things we're looking at from our perspective is trying to delve in, what are some of the causes? Are there things we need to be doing or implementing into our community to prevent the things that are causing and leading to this? We're also looking at this from a medical perspective and trying to do a better job at getting our providers and healthcare workers trained to recognize signs of abuse when they treat children. And we're getting some of the nurses in the area trained as sexual assault nurses to be able to do forensic exams when things are suspected or identified. And somebody is bringing people in to train their ER staff so they can do a better job of recognizing, documenting, and handling situations too, so that, you know, when this is identified, it can be dealt with appropriately.
And then we no longer need the child fatality review
That would
team.
Be great. If we can do away with the child fatality review team, that would be the best day of my life.
Yes. Yes, because I remember when we were talking about it, I was like, I need to step out now. I don't want to be a part of that. I can't.
It's not a team that everybody can participate
right.
in. Some people are not able to participate in that. We dig deep, we see pictures, it's hard, but you have to put that aside and realize that we have to do this so that we can make our community safer and our children's lives healthier. So
that they never come across your guys' meeting, which is very important. And yeah, that's very hard. And the goal is to make, this is all about prevention, because the sad part is this could have been prevented. A very small percentage of the deaths in our county are identified as unpreventable, and most of those are in neonates born preterm due to, factors that they're just not preventable. And things like that do happen, but a very small percentage of the deaths are actually ruled as unpreventable. Wow. Yeah, Well, one of the things that I do want to talk about is maybe a couple of the resources that we have in the community. I know that if you call 1-888-SOS child, DCS knows that's the number of DCS. They know where to branch you out to. They know that if it's a child being sexually assaulted, they know to get the police involved. They know FAC, which is the Family Advocacy Center, which is a huge resource to our community. And sadly, since 2011, I just talked to them the other day, they've had 1,200 cases in Navajo County of children sexually assaulted. That's astounding. Yes. Since 2011, and they keep everything here, and they're working with the hospital, getting those, like you talked about, the forensic nurses. And that's why this work group has been so important, because it's really bringing all the key players to the table so that we can develop a true community-wide strategy to make sure that people know these resources. And then another one was which is resources is the Safe House, which Change Point just took over, because we were going to lose that. And that was a valuable resource to men and women who have been abused, and a place to get the kids out of the abused home as well with their mother or father. And we have that as well. And so DCS knows if you call that number, okay, they need this service too. So there actually is one main number to go to that can funnel you down, so you're not like advocating for your kid, figuring out, okay, I got to call them, then I got to call them and stuff. It's that simple. Well, sorry, go ahead.
The best part about us all collaborating together is that when one of us starts working with a family, is that we can always give them a warm handoff versus the family having to really take that. I mean, we want them to take the responsibility and ownership as well, but at the same time, they're going through a really difficult time, a really possibly traumatic time, and it's hard to go to somebody new and say, is this person going to take care of me as well as the last person? Or I don't know these people. Do I have to tell my story all over again? And so when you have these different organizations working together, we can help and inform each other with the permission of the family, of course, so that they don't have to do it alone. And that's the biggest piece of it, is to have that network of support while you're going through or looking for information.
And they're not dropped. That's the biggest thing. I mean, one of the things with FAC is they're starting they come in, they remove the kid from the situation, they get the kid help, they prosecute this person, they put him in jail, which is awesome. But then previously, a while ago, that was it. But now they bring in counseling, and they help that child to not become a statistic, because when you're abused, you're sexually assaulted, or you see any type of violence, you have a child now that could end up later in the years having PTSD from that, but being an alcoholic, abusing themselves, abusing others just like they were abused. They're finding out that younger kids are abusing younger kids. Which is heartbreaking, and it was because those kids are a victim themselves. They're abusing a child that makes them a victim, and they're a victim too. And it's just this vicious cycle.
It is.
That needs to have a stop put to it. So I like the fact that I'm starting to hear now that these resources are building their staff to be able to bring in these new, following them all the way through, to make sure that when that child is I don't want to say rehabilitated, but the crisis is managed till it's gone, or continually managed after the fact, to where people are checking in, is this child okay?
And that's where those adverse childhood experiences come in, and various agencies have recognized the importance to providing resources to help prevent those life-changing negative behaviors as they age. And it's difficult to navigate the system for those of us who work in the system. I can't imagine what it's like for families and community members. So by reaching out to one of us, we can help navigate that process and refer to the next they need, and guide them through that and be a support to them. And they'll find that with whatever agency they start with, they're going to get the resources they need.
And empower them and give them those skills to be able to kind of move on with their own lives. So parents who were had domestic violence, or maybe one parent made all the decisions and the other parent didn't have any choice in the matter. They have to kind of go through rehabilitation themselves, in a sense, where they're learning how to make those decisions, how to manage finances, how to appropriately be a parent. Maybe they, like you say, it's a vicious cycle. Maybe their parents didn't parent them in the way that they really want to parent their children. So they might want some parent education or information about child development. And so, we have some early childhood programs out here, such as Healthy Steps, as well as Head Start and things like that, early Head Start, that can help provide some of that information and education to parents too. So those are all resources that help with kind of giving them the tools and support to kind of be able to move on once everything is managed.
I'm currently working, and I can say this because this is me, and I'm letting everyone know, I'm currently working with Healthy Steps. And my husband and I, we just were like, how can we better parent our kids? We feel like there's one of our children, we're not getting through to her correctly. It's frustrating us both. And we needed that extra help. So we went in, we made an appointment, and it was really eye-opening. Like, not that we're wonderful parents, but we didn't have those extra tools. And we're getting them. And just in 2 weeks, I'm like, wow, we're able to help our child, help her to succeed. And because it's me, I can say that and stuff. But it was very exciting to sometimes as a parent, you go in and you're just so frustrated or frazzled, like, I'm doing something wrong. All I'm here to do is make sure that my child succeeds, and I feel like I'm not able to do that. And there was nothing necessarily wrong with what we were doing. We just didn't have the right tools and the right understanding of what our daughter's situation was at the time, and how to communicate with her effectively. Which I mean, they say you don't have a book when you have a child, you don't get the parent book, but we actually have resources that can kind of provide that.
Yeah.
And all three of my kids are going to benefit from it.
Right.
Yeah, and it's tailored to, and I know we're going to talk about healthy steps in a future episode, but it's tailored to you and your family's individual needs based on your child's individual needs. And so that's what's so great about programs like that, is because they're not giving you generalized information. Oh, this seemed to work for, this group of parents. No, they're talking to you specifically about what behaviors you're seeing, what emotions you're feeling, what issues you're having, and helping you work through those and see kind of your child as a person and their own individuality, and kind of developing and helping that relationship.
And the biggest point to that is no parent is perfect. I don't care who the heck you are. And it is so important to be able to have those support structures. Understand there's resources in our community that can be a huge help to you to bring down that frustration. Because like I said, before we had Healthy Steps, Rob and I were just like, there's something wrong with us. We're not able to get through to her. We need to figure out how to help her. And they're not necessarily wrong, but we weren't communicating with her correctly. Each child, like you said, is different. We were getting those tools now, and it has taken our stress level down completely because we're actually helping our children. And it was nothing wrong with them. It was all about we were just missing those communication deals. We didn't have the right tools. So parents to hear, the resources are there. There's a way to get them. They can contact public health through that. They can contact Healthy Steps through that. They can, if agencies want to use your services, they can contact you for classes, mandatory reporting classes, things like that.
Well, we don't offer that type of training, but we can help them find the resources that they need.
Perfect. Yeah.
So if they don't know who else to go to and don't want to make 5 different calls, they can call us because we do know where to direct them, or we'll find a way to direct them.
How would they reach you?
So they can call our office, 928-367-6550. That's the Summit Early Childhood Outreach Department. And I know that we can put the number on later as well if you didn't get it this time.
Oh, yeah, we will.
But yeah, you can call the hospital and ask for Healthy Steps, and they can direct you to us. So there's multiple ways to reach us.
Well, thank you guys so much for coming on the show. We could talk about this forever, and I would love to. But thank you for the resources and the information, and thank you for watching Safe and Sound, and we'll see you next month.